Greetings, everyone. I hope you're having a nice day wherever you're watching us from around the globe. I am Mustafa ALshareefi, and today we're going to talk in this lightning talk about open learning design within health professional education. The title of our lightning talk is The Power of Open, a focused review on the role of open learning design in advancing medical students' learning and motivation. To begin with, we have no conflict of interest to declare. And in front of you are the people who have been working on this review paper. We have first Dr. Konstantina Papageorgiou, a second-year anesthesiology resident from Greece. We have me, Mustafa ALshareefi, a recently graduated doctor from Iraq. And we have Dr. Kaan, Mert, Guven, a PhD student in medical education from Turkey. Now, to start with, why did we choose this topic? Actually, each one of us was introduced to open education in their own unique way. Some of us were introduced to it through a conference or workshop, and even for some of us, it was mere curiosity to explore it further. And we found that this is a novel approach that has a lot of potentials and something could be implemented within our field, which is health professions education. And when we actually started reviewing the articles and papers that are related to the topic, we were kind of shocked that we didn't see so much papers or so much evidence-based when it comes to open learning design within health professional education. So we decided to conduct and create this review paper to be the spark and the baseline for anyone who's interested to build on that, and for us also to carry our further initiatives to have this as a solid floor to build on in the future. Now, starting with our search string, we have prepared first our search string when we were looking for papers, and the one that we entered in the database that we'll show you in a bit. And these were our inclusion and exclusion criteria. As you can see in front of you, that we were focusing on undergraduate health professions education, and the studies that were included in our design were primary studies. And we focus on studies that measures the impact on the learning outcomes of education, the students' motivation, and students' engagement. And our exclusion criteria were the following: is that every study or paper that was not openly accessed, and everything that was not in English. And the figure in front of you shows you our Prisma. That after we initially put our search string, within these 6 databases that you can see in front of you, we first got significant results, which was 5,367 studies, which is quite impressive. But after removing the duplicates and excluding them through their abstracts, we ended up with 29 studies that were worth reading the full text. And after reading the full text, meticulously going through it and eliminating everything that didn't have appropriate assessment tools or something that's concretely reporting the results, after removing one that was not in English and one that did not have participatory learning format within it, as we were focused on open learning design and open pedagogy, we ended up with only 6 papers. And when it comes to the result of our analysis for those 6 papers, of course, we had a distributed demographic distribution that was wide around the globe. We had the paper is distributed from Norway, USA, UAE, UK, and Australia. And when it comes to the methodological diversity, our studies had their own unique way of introducing a participatory initiative within health professions education. And as you can see in front of you is a summary table for the 6 studies that we included. Of course, this is not the full sheet that we worked on because the other one is bigger. And to include it here, you wouldn't be able to read the font, but these were the 6 main studies that we had them, and to summarize them, to move them further into the analysis phase. And these were the main results that we got out with. First, all the studies that were selected yielded positive impact on the learning outcomes, where that was represented by the students' knowledge acquisition, the critical thinking, and the application of the course concepts. And students actually reported deeper understanding of the concept that were under studies they were involved in. Second, we have the students' engagement, where it also yielded positive impact on the students' engagement represented by their interest, their collaborative endeavors within these initiatives regarding whether it was open textbooks or participating in the assessments, and the students develop some sort of ownership and community within their education, within their classroom. And the third indicator was, of course, motivation, and the selected studies provided positive impact and increasing in motivation, also represented by their intrinsic motivation, autonomy, sense of competence, and their confidence. And they have realized the value of the experience they were being a part of. Now, when it comes to the challenges that were mainly faced applying these participatory methods within health professions education, first, there's the gaps in students' experience, as not all students come from the same background, not all students are well capacitated enough to be participating in and to be put in the core of the spotlight. Second, there's the pressure of working in groups and the need for clear guidelines, as we are transitioning here from structured guidelines into more flexible learning environment where students were actually used more to have well-established curriculum to follow. For our recommendations are to provide clear guidelines when applying open learning design, because as we said, it's novel. Each institute has its own experience with it, and it wouldn't be easy to follow without having something clear to ensure that it achieves the maximum impact. Of course, we have to ensure the adequate representation within the students cohort, as students are put in the core of the experience because it's open learning design and open pedagogy. And finally, to have comprehensive and reliable evaluation methods, because as we told you that we had faced this issue of having so many articles not properly representing or documenting the impact of this method on the motivation, the learning, and the assessment and the engagement. For the limitations that we faced, of course, were the numbers of studies, because for a systematic review, you would expect to end up with a much more number of paper than 6. But as we said, this is a limitation, but at the same time, this is an opportunity because there's still a huge room for improvement. We have the heterogeneity of the studies as documented within the paper and the lack of structured evaluation method that we talked about earlier. And regarding our conclusion, first of all, as you can see, that the integration of open learning design within open education and health professions education yields positive impacts on those indicators that we specified. And when we say health professions education, we actually included medicine, nursery, pharmacology, dentistry, veterinary, and physical health and physiotherapy. All of these are included within the term of health professional educations within our definitions. And by adopting the open learning design principles within your institutions, actually the educators can create a more engaging and effective learning environment for their students. And of course, the evidence reviewed within these studies yields transformative potential for open learning design. Because as we said, it's still new, it's still novel, and that's the reason we had this study to begin with, is to start the spark for the future research, the future endeavors, and we have already started our second step to work on further implementation of learning design within health professional education, further studies and assessments, and to know the pros and cons, the tips and the do's and don'ts when it comes to the open learning design and how to implement it. And of course, these are our contact information. I would highly recommend anyone who is interested in working in open learning design within health professional education or open learning design itself to reach out to us, because we're highly motivated to work on that, and we'd be happy to assist you or help with anything that we can help with. And thank you so much, everyone, for taking time of your day and listen to this lighting talk.